It's another busy day in the Richardson household. Tony and her two children, Brian and Bianca, are dealing with the daily grind of work, school, and chores. They're also dealing with Tony's recent health scare. She's one of millions of Americans diagnosed with heart disease. In the past, many of these patients were faced with only one option: open heart surgery. That's a procedure where the surgeon makes an incision in the chest, cuts the breastbone, and exposes the heart. Recovery time could be months. Now, there are other options.
So the balloon's expanded, leaving the stent in the artery.
Dr. Stacy Smith and her colleagues work in the field of interventional cardiology, the treatment of heart disease with less invasive measures. One area on which they focus is treating patients with weakened heart muscles. A procedure that's proving to be a revolution in correcting this condition is cardiac resynchronization therapy.
It used to be that we actually did have to make an incision and open up the chest to put in specialized pacemakers and defibrillators, and now this can be done through the non-invasive approach. Patients are brought to the cath lab, and a very small incision is made underneath the collarbone. And under the x-ray, a pacemaker is put both on the right-hand side of the heart and the left-hand side of the heart. And the little computer coordinates the timing of beating between the right and the left side of the heart. Many patients see a significant improvement in their heart muscle strength. They tend to stay out of the hospital and not have to have as many admissions for heart failure, and they tend to live longer.
Another major step in the evolution of cardiac surgery is the treatment of blocked arteries. Many patients used to have no choice but to undergo open heart surgery or coronary bypass surgery. But now those same patients are often candidates for stent placement.
We go in through the femoral artery, which is an artery that we get to through the groin. We put a small tube in the artery. It's really essentially painless. And under the x-ray tube, we guide this small tube, it's called a catheter, up to the heart. And we inject some dye that mixes with the blood and allows us to see the arteries and to see the blood flow and to see the blockages under the x-ray. In this way, we can then guide small wires, small balloons, stents up to the heart, find where that blockage is, and open it up and restore normal blood flow to the heart arteries.
Even the stents themselves are going to work, healing the patient from the inside out.
Medicated stents are really the newest addition to our arsenal of treatment for heart disease. These stents are coated with different medications that when they're put into the artery and expanded against the wall of the artery, that medication seeps into the wall and it blocks the artery from forming a new blockage inside the stent. It's really been a revolution. For example, it's taken the chance of a blockage coming back from anywhere from 30 to 50% down to 1 to 5%. So it has decreased the need for heart surgery.
Welcome news for Terry, who at 38 years of age never even suspected heart disease could take over her life in an instant.
I was having shortness of breath, pressure on my chest, the heaviness in my arms and shoulders. I was going to Dr. Bowden, and she referred me to Dr. Smith. And Dr. Smith did a stress test and heart catheterization and found out I had 3 blockages.
Tony was the perfect candidate for medicated stents. Without them, she would have had bypass surgery.
She would have been out of work for a month. And she probably wouldn't have been back to really full function for approximately 3 months. Now with the medicated stents, she went home in 2 days. She has done wonderfully. She is back to work. Her heart muscle function has recovered. She no longer has chest pain, and she's doing beautifully.
In addition to the medicated stents, Tony carries around these words of wisdom from her doctor. Surgeons can only do so much. Patients have a role to play themselves. That's advice Tony is taking to heart.
Basically, exercise and to be on a low-fat diet. Yeah. So those are my main changes I've made. I feel wonderful. I feel wonderful. Yeah. Couldn't be better. Couldn't be better.
For Smart Medicine, I'm Rod Starnes.
Joining me now is the director of the Baptist Heart Institute, Teresa Dawson. Teresa, thanks so much for joining us.
Thank you for having me, Kim.
What should patients do to maintain their heart health once they get out of the hospital?
I think one of the most important things that patients can do is to follow their doctor's advice. Often we see patients come back into the hospital for readmissions and It's simply because of noncompliance. They didn't take the medications as their physicians prescribed. They didn't follow up with their physicians as indicated. But I think the best thing you can do is to maintain contact with your healthcare provider and do the things that they instruct you to do.
What trends are you seeing in heart health care?
The most important trend is prevention, and that's the one thing that we can do more of, is to increase awareness, make those changes that can prevent heart disease in the first place so we don't have to move to treatment modalities.
What medications are available or about to become available that can help folks?
There are many medications out there. Perhaps some of the most exciting recent advancements has been in the statin drugs, or the drugs that help to lower cholesterol. There are drugs that are in trials now that are actually being called the Drano of the cardiovascular system, where you can take a drug and it will go in and clear out those plaques, that have developed.
I love the idea of the Drano.
That's
What other things are you doing to help, so that people don't have to take medications for the rest of their lives?
I think one of the things that we're seeing is that many of the drugs that are available are sometimes for shorter term use to help correct a problem. If you use those drugs in conjunction with changing the lifestyle habits that can improve your health, then you may be able to come off of some of those drugs.
Teresa, thanks so much for joining us. That's a lot of great information. Thank you. To learn more